Good afternoon, everyone. Welcome back to our Ask Dr. Murphy segment. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Havey Institute for Global Health and the John Philip Bair Professor of Infectious Diseases here at Northwestern Feinberg School of Medicine, who takes the time to answer your COVID questions here on our Facebook page every Tuesday and Thursday. And today, Dr. Murphy will be answering viewer-submitted questions as well as addressing some of the latest COVID news through today, the 10th of March. And we invite you to continue to submit your questions to us should you have them via Facebook at NU Institute for Global Health or via email at globalhealthinstitute@northwestern.edu. And I will be leading the discussion today. My name is Kristen and I am the Communications Manager for the Institute. So Dr. Murphy, good afternoon. Thanks for joining us.
Good day.
Diving into the statistics here. So it looks like across Illinois, we're still seeing a 7-day average of over 1,000 positive cases per day. However, we are still seeing that decrease over the last 14 days. Do you expect that to continue? And what do you think this continued decrease is telling us?
Well, that's the question of the hour, because we don't know, since we've lifted most of the mitigations a week ago Monday, really what's going to happen. If there's going to be an uptick, it would start about now. And there have been some personal reports from some of the physicians here that they all of a sudden are seeing a couple more cases a day. Now that's just an anecdotal report from people I know around campus here, but we'll see what the state numbers show, because all these are recorded if they have a molecular test at a certified laboratory. Those tests are automatically reported. There's no doctor reporting involved. It's a laboratory report. So those numbers are pretty good. So we're going to see. The next couple of weeks are really critical. So, we give it, approximately a month from when we stopped the mask mandates and vaccine mandates, and we'll see what happens. So I hope it continues to go down, but there's no guarantee.
Absolutely. Well, fingers crossed. I know that the booster shots percentage, it looks like it stayed pretty stagnant at around just under 30%. With these, considering that we've lifted these mask mandates, do we expect to see the booster percentage increase or about stay the same?
Well, that's a very sad statistics, that people are not getting their third shot, the booster shot. There is a big difference in outcome on getting very sick from COVID and dying from COVID based on whether you had the booster or whether you didn't. You just got the first 2 shots. It's been shown in multiple studies, and that's why that booster is recommended. And they're even talking about giving boosters to kids now. It's not approved yet. But yeah, people should be getting the booster now, because what's happening now with the cases going down is that if there is, because there's so much COVID out there in the world, there's likely to be yet another variant. If you look at all these waves, all the waves are a couple months apart. So we may be in the clear for the next couple of months, and then boom, another highly contagious variant comes up that escapes the basic protection of the 2 shots of the vaccine and takes off, and it can take off in the vaccinated group, very similar to Omicron. So boosters are highly recommended. People should get it, and that will protect you for the future. It's just like why you get a pneumonia shot every 5 years, why you get a flu shot every year, to protect you and your family.
Absolutely. We have to be prepared for that potential next wave.
Yeah.
Moving into some of our latest headlines. So speaking of the current numbers and decrease in cases and whatnot, it looks as though global COVID-19 deaths have officially passed the 6 million mark. What can you tell us about this headline? It's obviously incredibly sad.
Yeah, it's a very sad statistic. So it's 1 in every 1,300 people in the world has died of COVID since the start of the pandemic. That's a lot of people, 1 million people dying. That's, like a war type situation. And very likely these numbers are undercounted, not overcounted, they're undercounted. The United States has the highest death toll number than any other country in the world. And in the United States alone, 960,000 people have died from COVID, and maybe up to another few 100,000 or maybe even 1 million have died because of the pandemic, but not from COVID. In other words, they didn't get screened for cancer, or they didn't see their doctor for their heart disease, or or they were afraid to go to the emergency room. These kind of secondary deaths, those are very important too. This death rate is much higher than peer countries. We're at the top of large peer countries, high income countries that are large. There are a few smaller ones that have slightly higher rates, but they're countries that have 5 or 10 million people. I mean, it's hard to compare to that. But of all the larger countries, we're number one. We are followed by Brazil, Russia, and Mexico, of the big ones, and they're pretty close to us. But still, we're number one. And why is that? Our response to the pandemic has been very fragmented. That's the problem. And we are under-vaccinated, under-boosted. We have the highest rate of obesity in the high-income countries, which is a risk factor for getting very sick with COVID-19. And you put all that together, and we've done the worst. We can learn from other countries and what they did. And we'll learn from, in particular, South Africa, which is not very heavily vaccinated, only about 30%, but they've had very strict mitigations. And so they have these peaks, and then they come down to almost zero, and then they loosen up again. So they've had like these 4 waves of infection, including Omicron was the last one. And they are seeing a slight uptick right now, but it's not a major phenomena at this particular point. So I like to look around the world and see what's happening there to predict what's going to happen here, because the way that we're treating this thing nationally is inferior to the way the other countries have behaved. Every other country has a national public health program. Our programs are run by the states, and some of the states are very counterproductive in their response. So, 1.2% of everybody infected in the United States has died from COVID. What if the mortality rate was 10%? Like it was with SARS. That's another coronavirus, by the way. Or with MERS, Mideast respiratory virus, the mortality rate is 30%. So coronaviruses are deadly. They cause all sorts of trouble, and we don't want to be getting this. And we can do things to prevent it. Vaccination is only one of those ways. But we can do the mitigations when the rates go up. And there's treatment now with Paxlovid, and there's monoclonal antibodies. Some of them still work. So there are things that we can do to lower that death rate. But public health measures are really going to help us the next time around, I hope.
Absolutely. Our next headline, speaking of vaccines, so we've got Pfizer noting they're launching a trial to test the COVID pill in children. Mm-hmm. What can you tell us about this trial run, and what do we need to know?
Yeah, Paxlovid is it's a combination drug. It's actually got 2 drugs in it. One of them is just a pharmacologic enhancer. It makes the other drug work better. Otherwise, the other drug isn't going to work at all, actually. Because it doesn't stay in the body long enough. So anyway, it's approved in adults. It works very well. It doesn't matter if you're vaccinated or not. And if you take it within the first 3 to 5 days, it reduces the risk of hospitalization by 90%. It doesn't matter whether it's Omicron, Delta, or whatever. So it really works. So, kids that are very sick or at a high risk themselves, this would be a great tool to have. And so they're studying it in children. That's basically the point. It's already approved in adults.
Great. Our third headline, so this came out yesterday, a new study showing that folks who have had even a mild case of COVID could have a potentially sign of aging or accelerated aging of the brain. The study came out in Nature. What can you tell us about this study? And I mean, obviously the headline is a bit concerning. What do we need to know here?
This is an important study that highlights the problem with getting COVID-19. It's not just the cold. Colds, you just get the sniffles, you maybe have some aches and pains for a couple of days, you get better. There's no long-term problems. COVID-19 is very different. People die from COVID-19. What this study is showing, even in people with mild disease, they have brain problems from COVID. It affects the brain of people. It affects pregnant women adversely. It affects the sperm counts and function in men. There's all sorts of stuff that this virus does, and we don't know the really long-term side effects. We just know that there are long-term side effects. And it's somewhere on the order of about 14% of people are going to have some type of problem 6 months later. Now, it may not be too severe, but what if it's brain fog? What if it's difficulty concentrating and you have a very analytic type job, or just gives you fatigue and it's just hard to get through the day? This isn't good. This is a terrible disease. We have to take this seriously. It is not like just getting the cold. From a public health point of view, when let's just assume the worst case scenario is 14% get long COVID and 1.2% die. So what really that means is 86% of people recover and do well. So they say, that was nothing. I got over it. I don't have any side effects after a couple of weeks or months. But what about those 14% that have side effects long-term, ended up in the hospital, or who died? You have to think of it in terms of the whole population that's at risk.
Absolutely. Well, it's an incredibly important and concerning study. And so we'll definitely see what more is to come and what more we're able to find out in the coming months and years. Our final headline, speaking of school districts, so studies have come out that school districts with mask requirements have had overall lower COVID-19 incidents compared to districts with mask optional policies, which a CDC study has found. Dr. Murphy, tell us, I know that obviously mask mandates and mask requirements are being lifted in schools with young children. Do you think it's too soon? What can you tell us about the findings of this study?
Well, I mean, there's no surprise here. When you use masks, they work. So this should be absolutely no surprise, but this is good data that show that if the schools that have the mask, they have less COVID. That means they have less people in quarantine, less people are sick, less people are out, less secondary cases occur among family members of the people that are sick and staff and teachers. This has been shown before, even at the county level. Counties that had, a lot of states leave it up to the county to do the public health care. They did a nice nice study in, I think it was Kansas, where they compared counties where they had mitigations and counties where they didn't, and there was a big difference in outcomes. And it's been shown multiple times. So the point is, masks work, and if the cases go up, masks should come back to these places that are dropping the requirement.
Absolutely. Masks work. That's what we've learned. First COVID question submitted by our viewers today. So Dr. Murphy, this individual received their COVID tests from the government in the mail. It was only 26 degrees. They had left the post office 7 a.m. in the morning and were delivered around 5 p.m. So had been out and about all day. And obviously I know that folks have been concerned because it notes that they need to be stored between 35.6 between 86 use. Are they still viable?
Well, this is a good question, and it came up a lot because these things were shipped out in the middle of the winter.
Yes.
Now, okay, they don't recommend that the stuff gets frozen. If it's frozen for a brief period of time, it's probably less damaging than if it was frozen for a week. Nobody really can answer this question. However, before you use the test, make sure the test is at room temperature, even if it froze for a couple hours or a day or so being delivered. And if there's any question about the result, particularly if a person has some kind of symptom and they use this thing that had been frozen, go get a different test. The pharmacies are loaded with these tests now. I was just at Walgreens yesterday, and before you couldn't even get the test. They were just flying off the shelf. Now there's cases and cases and cases of them. You can get another one, or you could find a case where they'll test you for free. So if a question comes up, if it's a critical question, go get a different one. But otherwise, you can use the ones you got. Just let them get to room temperature.
Great. Our second question, we have two individuals inquiring about if there are any local studies being done on the long COVID effects in seniors. These individuals were both very sick, not hospitalized, but are feeling like they can't get back to quote unquote normal. And I know that a lot of times these seniors feel as though they're just kind of getting written off as they're just getting older. But are there any studies being done about what's actually happening here? I know we talked about the study above in Nature, but anything in specific?
No, this is a huge problem. And it's not just seniors. It's everybody, even in children. It's about this 14% or so, and there's ranges from 5% to 30%. It just depends how the data are collected. I like the 14% because it comes from the Kaiser Family Foundation, who looked at a really controlled large group of people that have medical records that are followed for a long time. So anyway, nobody's writing these people off, but the studies are going on around the world in exactly what happens with these seniors. So I wouldn't say that it's being written off. It is being studied, but it's not being studied everywhere. So obviously wherever these people are, presumably they're from the Chicago area. Whether there's a study going on or not, I know there is at Northwestern, Dr. Koralnik in the neurology department does have a large group of patients that they are following that have some kind of neurologic, like even if it's fatigue or, fuzzy thinking or, anything like that, they are following them and treating the symptoms, but not the core cause of the disease, which we don't really even know. So you can look around wherever you are and see if there is anybody doing that. You're going to have to do a little homework on your own. But it's not being written off, but it's, and you're going to hear a lot more about this as time goes on. Very important problem.
Very. Our third question, this individual is fully vaccinated and they are inquiring about wearing a mask at work or in any public setting to protect their unvaccinated 2-year-old at home.
Yeah, I mean, it's estimated by the Centers for Disease Control that about 30% of people should be wearing masks indoors. And, if you're afraid of a vulnerable person, in this case, it's a 2-year-old at home, which is pretty low risk for big time problems, but still the person is at risk because they're not vaccinated. The vaccinations are not approved for under 5 years of age. Or if you have an older person at home or somebody with an underlying disease, you have to be careful too, because you don't want to bring that home. So yes, it would be a good idea if this person did wear a mask in public settings that are indoors. And I hope what happens in responsible areas that you always will be seeing a group of people wearing a mask all the time and not make a big deal about it, because they're just trying to protect themselves, like this person is doing very responsibly. And there's so many different reasons why you don't want to get infected. You've got an underlying disease yourself. You're living with somebody with an underlying risk factor or disease. And like, it's nobody else's business. Just put your mask on when you go out so that you don't bring it home. You know, when if this thing really burns out, we'll know, and the recommendation will come out that we don't have to do anything. Let's hope for that, but we're not there yet.
Absolutely. Well, for our final question, we have an individual who recently developed symptoms of Parkinson's disease after getting their second vaccine shot. They're feeling as though it might be related to getting the vaccine. And do you know if there's any possibility of such a reaction? Has anything come out in the past that could correlate these two?
Developing Parkinson's or other neurologic diseases has been reported very, very rarely. Nobody really knows if it's a cause and effect situation, but there have been at least 3 cases that have shown some kind of temporal relationship. That means like 2 or 3 weeks after the vaccine had happened. So if there's a link, it's possible. And these cases definitely all need to be reported on the VAERS reporting form, VAERS. And that's, anybody can fill that form out, but typically the doctors fill it out and submit it to the FDA so that we can collect this data because it's very important. So any kind of neurological disease can show up after that, but it's super rare.
Good to know. Well, Dr. Murphy, that's all we have today. Thank you so much for your time, and we will see you next week.
All right. Thank you.